Hi, greetings from the lockdown. This is Prashant, and here is the video I promised. We're doing the beauty insight. I think that's even more valuable than coming to the clinic and doing some treatments with me. Um, and the first thing that you need to teach yourself is how to do meditation. But before we go to figuring out how to do meditations, I want you guys to familiarize yourself and also try to get comfortable with the Wim Hof breathing technique. Now, Wim Hof is a very charismatic athlete. He's known as the Iceman, and I'll put a few links to uh, his website and his videos on the YouTube, which I'm sure you would love to see. He has devised this breathing technique on the basis of the pranayama, which is a breathing technique described in the yoga, and also derived it from a Tibetan variation of yogic pranayama, which is called Tummo breathing. There are many different kinds of breathing techniques. I mean, pranayama is from 1,600 years back, uh, but all of them are trying to uh, get you into increasing your vagal tone, and I will tell you more about vagal tone as we proceed in this series of videos. But essentially, they're trying to increase the heart rate variability or the beat to beat variation in conjunction with your breathing. So, um, besides improving your lung capacity, besides improving your breathing, we will also be changing the balance of your uh, stress hormones and your calming hormones. The stress hormones primarily being the sympathetic system, and the calming hormones are related to the parasympathetic or the vagus nerve, which we'll talk about later. So today's video is primarily to do with figuring out a Wim Hof breathing technique. It to me is a controlled hyperventilation, and it actually changes transiently the pH of your blood, the amount of acidity or alkalinity. Uh, so your blood becomes a bit more alkaline while you're doing this controlled hyperventilation. Hopefully, all of you now have either the Wim Hof app on your iPhones or the Breathe Bunny app on your Android phones. Unfortunately, the Breathe Bunny app is not on the iPhone. It is a very nice app to have, but today's video is going to be applicable to both the apps. So Wim Hof's breathing technique, or the variation of the Tummo breathing that he has devised, is in terms of a set. So one set would be 30 breaths. Those 30 breaths would be followed with a retention or holding, a breath holding period, and that breath holding period would be followed by a long inspiration and then holding the breath again for 10 to 15 seconds, and then you let go, and the second cycle begins. So you do 30 breaths, then at the end of the 30 breaths, you hold your breath for as long as you can, and then when you can't hold it any longer, you take a long deep breath in, you hold it for 10 to 15 seconds, and then you breathe out, and when you're ready, you start the next round. So you try to do this for 3 or more, but whenever you're considering doing these breathing techniques, please consider that This is controlled hyperventilation. It is going to mess up the carbon dioxide levels in your blood. Uh, it is going to mess up the delivery of oxygen to your tissues. It can actually go beyond just feeling lightheaded or feeling tingly all over the body, which most people will do quite safely. But it can also go to the extent of causing you to feel faint and actually go unconscious in the rare event. And so you shouldn't be doing this if you are in your bath or if you're in a dangerous place. So we are going to start the breathing technique. I need to set up the timer. So I'll catch you on the next video. So hopefully you are either going to sit comfortably in a safe place, and or you're going to lie down. Once again, if you have got any pre-existing medical conditions, please do not do this without consulting your treating physician. Even if you're taking some kind of medication for blood pressure, or if you're prone to fainting, please do not do this in an unsupervised environment. We can always do this when the clinic reopens, and you can sit with me in the clinic and practice this. So if you don't have any pre-existing medical conditions, and if you want to try this out, it is a brilliant thing. And I do it every day. And it has been shown to change your immune response in a beneficial way. It has been shown to uh, make you much more calmer, uh, much more resilient to stress. So catch you on the next video. Bye for now.